today we will talk about the pediatric history taking. So the common steps involved in the history taking are biodata, cheap complaints, history of presenting illness, systemic history, past medical history, past surgical history, developmental history, immunization history, birth history, feeding history, medication history or drug history, family history, allergic history, socioeconomic history, and the personal history. So the first step in the history taking is biodata. And biodata asks about the name of the patient, age of the patient, gender, father name and his occupation, address of the patient, mode of admission, whether the patient is admitted to OPD or emergency, the date of admission, and the time of the admission. Second step is the chief complaints. So chief complaints are the symptoms due to which the patient presented to the hospital, and always write the chief complaints and the patient own words. In pediatric age group, especially in newborn and the infants, write them in their parents' own word and mention the duration of each chief complaints, and always write the chief complaints in chronological order, which means write them from the older one to the new one. Let's suppose if a patient presented with a complaint of fever from 4 days and vomiting from 3 days. Next step is the history of presenting illness. So in HOPA, explain all the chief complaints in detail and paragraph form. And start it as let's suppose if a patient was well till that, but now from the last 3 or 4 days he or she had a complaint of fever, and then explain the fever in detail, like ask about the fever pattern, whether the fever is continuous, intermittent, or remittent in nature. Also ask about any previous episode of fever or as per onset, whether the fever is gradual or sudden in onset. D as per the duration means that how long the episode of the fever lasts. And C as per the any chills or vigors or sweating associated with fever, and S stand per other associated symptoms like headache or rash associated with the fever. S stand for the source exposure, like any history of travel or sick contact associated with the fever, and S also stand for severity of the fever, whether the fever is low grade, intermediate, or high grade, and T stand for any treatment taken, like any medication used or rest for relief of the fever. So the mnemonic for the fever history is F podcast, in which the F stand for the fever pattern, P stand for previous episodes of fever, O stand for onset, D for the duration, C for chills or Vegas, S stand for other associated symptoms, S for the source exposure and severity, and T for treatment. The next one is a systemic review. So, in systemic history, ask about each and every system in detail. The first one is the general history. So, in general, ask about the change in the weight of the patient, any history of weakness or loss of appetite, and fatigue. And ENT ask about the history of hearing loss, ear infection, or any discharge from the ear, any history of nasal obstruction, snowing, nasal bleed, any history of enlarged lump or gland in the neck region, any history of sore throat or mouth ulcer. And GIT ask about the history of vomiting, nausea, dysphagia, regurgitation, heartburn, hematemesis, diarrhea, constipation, abdominal pain, abdominal distension, and incontinence. In respiratory system, ask about a history of chest pain, dyspnea, coughing, wheezing, hemoptysis, and the hoarseness of voice. And CVS ask about the history of atopnia, chest pain, dizziness, cyanosis, and paroxysmal nocturnal dyspnea. And urogenital system history asks about the plague pain, fever, history of discharge from genitalia, which is seen in pelvic inflammatory diseases, increase in urinary frequency, urgency, incontinence, hesitancy, poor streaming, dribbling, nocturia, dysuria, and hematuria. And CNS history asks about the change in the behavior of the patient, memory loss, history of anxiety, depression, tremors, loss of consciousness, pets, sensory disturbances, muscle weakness, paresthesias, dizziness, change in the sense of smell, vision, any loss of hearing, or any history of headache. And musculoskeletal system history asks about a history of muscle ache, joint pain, swelling of joints, limitation of movement, and gait disturbances. And skin history asks about the history of skin rash, any petechiae present, or birthmark present. And past medical history ask about the history of diabetes in pediatric age group. Type 1 diabetes is common. Also ask about any history of pets or convulsions, any history of hypertension, hepatitis, or asthma. And past surgical history ask about any surgery done before, and also ask about the cause of the surgery and any history of blood transfusion. Next is the allergic history. So, an allergic history asks about any history of allergy to a drug, and I'll note that always give a test dose before administering the antibiotic for the first time. Next is the immunization history. So, always ask about the vaccination history of the child and check all the vaccines are up to date or not. And medication history ask about any history of prior medication he or she had taken, and also ask if he or she is currently on medication, and also note the dosage of these medications also. Next is the birth history. So in birth history we have the prenatal history, natal history, and the postnatal history. The first one is the prenatal history. So in prenatal history ask about the history of maternal infections, any history of drug intake during the pregnancy, any history of trauma, abnormal bleeding, ask about the previous number of pregnancies and its outcome, and also ask whether she had taken a folic acid supplements or the iron supplements, and whether she had done the tetanus injections or not. And similarly, also ask about the antenatal scans done and any specific finding and at. Next is the natal history. So in natal history, ask about the place of the delivery, whether it is a home delivery, a hospital delivery, and the delivery performed by either a doctor or a trainee. Similarly, also ask about the mode of the delivery, whether it is a normal vaginal delivery or C-section. Similarly, also ask about whether it was a full-term pregnancy or preterm. Also ask about the conditions of the baby at the time of birth, and any instrumentation done or any complication during the pregnancy. Similarly, also ask about the birth weight, also ask about the labor history and any history of premature rupture of the membrane. And postnatal history ask about any illness in the neonatal period. Ask about the cry, whether it was immediate cry or delay. Similarly, also ask about any history of jaundice, respiratory illness, or cyanosis in the early neonatal life. Similarly, also ask about whether the vitamin K injections were given to a neonate or not. And similarly, also ask about the duration of the stay in the hospital after delivery. Next is the feeding history. So, in feeding history, ask about whether the child is breastfed or not, and also ask about the duration of the breastfeed and its frequency. Similarly, also ask about any history of artificial feed and the type of milk used, and also ask about when the weaning was started and the frequency of weaning, and also ask about the current diet on which the child is. Next is the developmental history. So, in developmental history, ask about whether the child has achieved the developmental milestones on time or not. Like a baby start a social smile at 1 month of life, start neck holding at the 3 months of life, sitting at the 6 month of life, crawling at the 10 months of life, standing at 1 year, talking single word at 1 year, start walking at 15 months, and combining your two words at 2 years of life. Next is the family history. So, in family history, ask about the age of the mother and father. Also, ask about the number of siblings and their ages. Also, ask about any history of chronic disease running in the family, like a history of hypertension, diabetes, stroke, asthma, or cancer history. And social history, ask about the educational status of the mother and father. Also ask about the income and its source, and similarly also ask about the living standards. In environmental history, ask about whether they live in their own house or rented house and the number of rooms in the house. Similarly, also ask about the number of family members. Also ask about the source of water, whether they are using well water or the tap water. Similarly, also ask about the sanitary conditions. In personal history, ask about the behavior of the child at home and school. Similarly, ask about the sleep patterns and habits and interest of the child, and similarly also ask about the performance of the child in the school. At the end, say thanks to the patient and his or her parents. So it was all about the pediatric history.